Welcome to the world of the ventilator, where you, the nurse, will be learning the inner workings of the ventilator and the general connection with the respiratory system, cardiovascular system, and nervous system. Let's look at your patient's records. Oh my, your patient has emphysema. Your patient had normal lungs, but with years of smoking, their alveoli elasticity has been damaged, making it hard for your patient to breathe, or exhale, but also inhale. So what are we going to do for our patient? Well, let's put him on a ventilator. Using a ventilator, we could directly monitor the patient's flow, CO2, and his pressure. With the information that we've received from the ventilator, we could determine how much O2 to give in a given period. That O2 level will be given directly through the endotracheal tube, also called the ET tube. But we'll be focusing on exhalation, a troubling factor for emphysemic patients. The ventilator has two channels or lines which are separated by inhalation and exhalation. So we'll be looking especially at the expiratory line that will be taking the CO2 concentration from the alveoli back into the ventilator through the ET tube or endotracheal tube back to the ventilator. So the ventilator will know when to quote unquote exhale because the ventilator is going to directly monitor the flow of O2. So here the area above is positive, so the patient is receiving oxygen, so inhalation, and then below, the area below is exhalation because they're not receiving oxygen. Also pressure, so the pressure in the chest cavity. So this is exhalation, and then this is inhalation. And volume in the chest cavity. Inhalation, because you need a greater volume for the alveoli to expand, and then exhalation. So you also see that pressure and volume are inverses of one another. So when one is low, the other is high. So here's the monitor of a ventilator. So looking directly at the monitor, you can see inhalation and exhalation given to a patient over a set time and a set amount. Ideally, you want your patient to be at 12 to 20 breaths per minute. This is their respiratory rate, but we'll be looking at the stimuli. But this also depends based on age. The normal respiratory rate depends on these stimuli. So these contribute to the normal inhalation and exhalation. The pH, the PCO2, so partial carbon dioxide, partial oxygen concentration, and H concentration. We'll be looking at pH levels. So this is the normal range for pH, from 7.35 to 7.45. So when the pH goes above 7.5, a stimuli will be detected. So this will lead to exhalation, so releasing CO2. This is negative feedback. And when the pH goes below 7.35, you'll inhale, and so on until, let's just say, a positive feedback occurs. So this will be continuously inhaling. So you want to exhale here. And so this is positive feedback. So how can we fix this? Well, let's look first at how your body would normally control the situation. Now let's look specifically at the green negative feedback. So going above a pH level of 7.45. So a stimulus will be detected at an aortic arc chemoreceptor or a common carotid receptor. So this is just an overview of afferent and efferent pathway. The common receptor located at the aortic arc or the common carotid will pass an action potential when it detects a high pH level. That action potential will depolarize the vagus nerve that will go directly to the medulla oblongata. So specifically at the VRG, the expiratory center of the medulla oblongata, this will pass the message to the internal intercostal muscles by going through the intercostal nerves, passing it to the intercostal nerves and external intercostal nerves. This will go to the effectors, the intercostal muscles and the external intercostal muscles, and the diaphragm, going through by the phrenic nerve going to the diaphragm. So the effectors, the internal intercostal muscles, and the diaphragm. So the intercostal muscles will contract, the internal at least, and the diaphragm will ascend. This will lead to an effector response of exhalation. Also, external intercostal muscles will relax, so it's going to descend. These emphysemic patients will be forcibly breathing, or as here, actively breathing, so their intercostal muscles or internal intercostal muscles will contract. So ribs will be pulled up and abdominal muscles will contract, so it will rise. But your patient will not be normally doing this, so the ventilator will monitor indirectly the pH, and through the endotracheal tube will directly take back that CO2 or carbon dioxide levels through the endotracheal line into the ventilator. Now your patient is back to their normal range. You have successfully made your patient exhale. Well done. Now hopefully we can get him back to inhale. Stay tuned to next week's video on inhalation done by the ventilator. Good luck. See you next week.